Thank you for listening to another new episode of Little Eyes, Big Topics. In this episode, Dr. Jennifer Galvin sits down with Dr. Stacy Pineles and Katherine Weise, the co-chairs of the Pediatric Eye Disease Investigator Group, to discuss current and future research in children's eye conditions.
Welcome, everyone. Welcome to Little Eyes, Big Topics, an APOS podcast. I'm Dr. Jennifer Galvin, and on behalf of the Digital Education Committee at APOS, I have the honor and privilege of talking with the two co-chairs of PEDIG, today Dr. Stacy Pineles and Dr. Kathy Weise. For those of you who may not know who are listening what PEDIG is, PEDIG stands for the Pediatric Eye Disease Investigator Group. And today we're going to talk about the current and future clinical studies in pediatric ophthalmology and optometry. And PEDIG was formed back in 1997, and it's fully funded by the NEI, the National Eye Institute. And currently, as of last year in 2023, there are 448 active investigators of both pediatric ophthalmologists and pediatric optometrists. So it's a very collaborative network. And basically, PEDIG is dedicated to facilitating multicenter clinical research in all areas of children's eye conditions, such as strabismus and amblyopia and beyond. So welcome, Dr. Pineles, and welcome, Dr. Weise.
Thank you so much for having us. This is an honor.
Of course. So just a little bit about both of them as the network co-chairs is that Dr. Stacy Pineles is a pediatric ophthalmologist, and she's a professor of ophthalmology at Jules Stein Eye Institute in UCLA. And Dr. Kathy Weise is a pediatric optometrist, and she's a professor of optometry at the University of Alabama, Birmingham, known as UAB. So Dr. Pineles, tell us a little bit about yourself and your involvement with clinical pediatric eye research, and in particular with PEDIG.
Okay, thanks, Dr. Galvin, and thanks again for having us. So a little bit about myself. I'm a pediatric ophthalmologist at UCLA. I also am fellowship trained neuro-ophthalmologist, so I have a clinical interest in pediatric neuro-ophthalmology. I became involved in PEDIG during my K-23 award time period, which is a career starter grant that's funded by the National Eye Institute. So when I first joined the faculty at UCLA, I applied for a K-23 career development award. And as part of that grant, part of my career development plan was to get involved with PEDIG so that I could learn more about clinical trials. And this was about 14 years ago now. And through the grant, I was put on several committees so I could learn about PEDIG. I was placed on the executive committee and on writing committees and on planning committees of studies. And during that first 5 years of my practice and my time on the faculty at UCLA, I was really able to learn a lot about planning clinical research and analyzing data from my participation in PEDIG. Then after that, I sort of pivoted and worked on my own research and also took on the role of residency director at UCLA and came back to PEDIG a few years later with an idea for a study looking at pediatric optic neuritis, which is a rare disease. And I was the protocol chair for that, and I got more involved in PEDIG during that time. And then last, a couple years ago, PEDIG started looking for a new co-chair for the network because Jonathan Holmes and Sue Cotter were finishing up their term. And so I thought it would be a really great opportunity to help the network come into a new age and try to look at other diseases other than amblyopia and strabismus, and also look at some more modern clinical trial designs for some of our bread and butter conditions like amblyopia, refractive error, and strabismus. And so I applied. And I was chosen. And so together with Dr. Weise, we wrote the grant for PEDIG to be funded again through 2029. And we're lucky enough to get the funding. And so that's where we are.
Oh, that's wonderful. Yeah, that's a great perspective. And likewise, I want to ask you similarly, Dr. Weise, tell us about yourself and your involvement with pediatric clinical eye disease as well as PEDIG.
Yeah, so I think one thing that Stacy reflects is how differently you can get involved with PEDIG. You can bite off as much PEDIG as you would like to chew, is what I like to say. So, doing everything from being an investigator and enrolling patients to being on writing committees to being, all the way to the co-chair. So, her story is very cool and representative. I was asked to do a pirenzepine study, the tolerability and safety phase, back in 1996, toward the end of my residency, and then my mentor, Wendy Marsh-Tootle, asked if I wanted to be the COMET investigator, which was a big deal U award funded by the National Eye Institutes. There's only been around 11 of them. COMET is one of them. So I'm grateful that she saw something in me that I didn't realize I had, and she mentored me. And then, around that time, Dr. Bob Rutstein and she were early on getting involved in PEDIG. And so they were part of the ATS 1. Some of us like to tell when we started, I got involved in ATS 3. We're up to ATS 24 right now. And so ATS 3 was the older kids with amblyopia. So that was the beginning. More recently, I was the co-chair with Mike Repka for the myopia treatment study number 1. It was the first time PEDIG got into the myopia space, and I think we did a really good job. I've served as vice chair, and really there wasn't a co-chair in optometry up until 2019 when Sue Cotter was the very, very first one over at Ketchum, Southern California College of Optometry. And so she's really the leader here. She busted down some doors so that the rest of us could walk on these trails along with many of our other mentors. So I'm grateful for her, but a lot of us want to be like her when we grow up. So just following in the footsteps of some really great mentors that I've had.
Well, that's wonderful. Thank you for sharing that with us, Dr. Weise and Dr. Pineles. So Dr. Pineles, at UCLA and Southern California in general, where should an interested trainee, whether that trainee be in medical school or in residency, get involved in pediatric eye research?
In Los Angeles specifically, there are 3 institutions that are doing pediatric eye disease research in the clinical realm. Those institutions include UCLA, USC, which is associated with the Children's Hospital of Los Angeles, and then Southern California College of Optometry. All 3 of those have a PEDIG investigator site and participate in PEDIG, and also do other independent research related to all different types of pediatric eye disease. In the greater area of Southern California, you have UC Irvine, Loma Linda, and UC San Diego. Those are all options for people who have research interests and live a little bit further away from Los Angeles.
And Dr. Weise, in a similar vein, at UAB, Greater Birmingham, is there a particular site or place where you would recommend an interested trainee, whether they be in optometry school or medical school or a resident, where they can pursue pediatric eye research?
Absolutely. I would say, where it's going to be at is UAB Pediatric Optometry is going to be one of your main ones. There's only 24 schools of optometry in the U.S., and that's where you're going to get your really good foundation for pediatric research. Birmingham is the mecca of pediatric eye care, and we've got a fantastic School of Optometry right next door to a Department of Ophthalmology and the only level 1 trauma ER in the Callahan Eye Hospital. So a really big mountain of wonderful pediatric eye care. Within the School of Optometry here in the pediatric department specifically, we've had over 25 years of continuous NIH-funded research, including PEDIG and COMET, as I mentioned before, but also the CITT studies. We also do some industry-sponsored research, and even within the myopia treatment study, one thing that's great about the Birmingham area is that we have a lot of underrepresented minorities, and within that study, we had of the 25 that we had of the 187, we had the highest retained in the group, and 60% of them were underrepresented minorities, and including our coordinator Jennifer Montejo just finished her MPH with a 4.0, so she's wonderful, and one of the reasons we're doing that. But outside, the Birmingham area and the UAB Medical Center is the Vanderbilt Eye Institute, where we have a UAB School of Optometry sponsored pediatric optometry residency. It's only been around for a few years, and it's extremely competitive. So we're super proud to have that pediatric residency experience where you can get involved in PEDIG up there as well. So, and then after that, you've got a lot of great residencies where you can go to a school of optometry or an institution that are, very busy in PEDIG, including, SCCO and ICO, Houston, Ohio State, Salus is good. And then we've got some hospital-based residencies in PEDS, Duke and Children's in Cincinnati, Akron, Nationwide, Mercy in Kansas City. But, one problem that we have, I think, in pediatric eye care, which is why I'm so excited that you're doing this, is that we need more pediatric specialists and we need to increase, access to care. And 75% of the sites within PEDIG are at an institution like UAB, but 25% of them are in the community. And so that's where, anybody could get involved, whether they're at an institution or not. If they're interested in pediatric eye research and they want to reach out to the, Pediatric Eye Disease Investigator group and become a specialist, they need to have had a pediatric residency to become a full investigator. If they want to become an associate investigator, typically the yardstick is doing pediatrics at least 50% of your time over the course of 2 years, and then you can be eligible for a full investigator if you had not done a pediatric residency. So we will take all comers who are qualified and interested.
That's a great point. Thank you, Dr. Weise and Dr. Pineles. I know on your website that there is information about what sites are active sites that the potential investigators can join, as well as trainees could go to become involved in the pediatric clinical research. So that's very helpful. And on that same note, Dr. Pineles, what are some upcoming or future studies that are going on at PEDIG that you'd like to talk about today?
I think I'll talk about our next upcoming study, which is a paired set of studies looking at dioptic treatment for amblyopia. That is treatments that are presented binocularly to patients using 2 different devices, which basically present either a movie or a game with some graying out or blacking out of parts of the image in the stronger eye, and then a more vibrant image in the amblyopic eye, as a way of treating amblyopia instead of using a patch or atropine. And our network has interest in these devices. One of them, at least, is FDA approved, but they haven't been well compared to gold standard treatments. So the first study that we're going to launch is called ATS-23, Amblyopia Treatment Study, and it's the 23rd one from PEDIG. And this study will look at a treatment called luminopia, which has already been studied and FDA approved for young children with amblyopia, but it hasn't been compared to the gold standard of treatment, which is patching. And patching is a lot less expensive and in some ways simpler for patients. So we want to be able to compare this device to patching. And so we're launching that study very soon, and children will be randomized to either have patching or the luminopia device. And the nice thing is patients who got put into the patching group will have access to the luminopia device at the end of the study. So they'll still get a chance to try the new treatment, but we'll be able to answer questions related to quality of life and improvement in visual acuity in the 2 different treatments. And then in an older cohort of patients, we'll be studying luminopia compared to glasses alone, and then another device called Vivid Vision compared to glasses alone. And we can see in the older cohort if these devices are equivalent to glasses alone. And then the next step, of course, would be to compare it to patching if we find that they're efficacious in the older age group. So I'm really excited about those studies. I think patients will be excited to have access to these devices, and investigators are always looking for alternatives for the treatment of amblyopia. So it's a really important question and a very common disease.
That's great that ATS-23 is going to be rolled out soon. And as someone who has used some of these technologies, in particular luminopia, that with parents and patients, there's a lot of interest in the new technology to treat amblyopia, and there hadn't been the comparison to the standard of care with patching. Dr. Weise, is there a recent or future study that you would want to talk about that's coming up with PEDIG, or one that had just finished?
Well, probably the most exciting one was the one that I alluded to before. It was myopia treatment study number 1. So it was our first steps into the myopia world, and myopia has been very well established. And so I was actually worried that, can PEDIG conduct a study in myopia when the rigor is extremely high. The studies are a little bit longer than PEDIG is used to doing. And we had, we're experts in amblyopia and strabismus, but we hadn't done myopia yet. So, in fact, I think we did a great job. We looked at manufactured atropine at 0.01% versus placebo, and 2/3 of the kids got the 0.01% and a third got placebo. It was kids who were 5 to less than 13 years old and -1 to -6, and we put them on treatment for 24 months and then randomized treatment. And then we took them off for 6 months to see if there was any rebound effect. One great thing about PEDIG is that we can recruit, patients of all types, and we had 55% minority in this study. So it increases our generalizability to reflect a little bit better of what the US Census looks like. So I was proud of that fact as well, and that was study-wide. We also retained 94% of our patients, which was very, very good. Blank and Comet, which were glasses and contact lens studies, were up there at 99%. But if you're looking at, something like atropine that doesn't give you any visual benefit to the eye, most of the studies were, looking at 80% or 70% retention. So I wanted our retention to be in the 90s, and we got there. We also had excellent adherence at 93%. And keep in mind that was during COVID. And so all of the kids kept getting medicine throughout COVID. We were wearing hazmat suits and we were meeting them at the door, and 94% of them got into their 24-month visit. So despite a worldwide pandemic, we had a really rigorous study, and it was also funded by the NIH because PEDIG is funded by the NIH. So it's, I'm proud to say it was our tax dollars at work and stuff. But what we showed was that at no point in time did the atropine have a different treatment effect than placebo. And although that was a negative outcome, I think it's still super important because, as pediatric eye care providers, we really need to direct our patients to consider the most effective treatment options, especially because these can be very expensive. So super proud of what we did with MTS1, and we're looking forward to MTS2, so stay tuned.
I was just going to ask you, is there a timeline for when it may be rolled out that we could share with our listeners? Or
Yeah, so we're hoping within the year. We would love to do it by the end of the calendar year, by the end of 24. We want to look at a higher dose than 0.1 of atropine, most likely 0.05%. And then we also want to look at these special spectacles from our different companies that use lenslets or reduced contrast, and see if myopia-specific lenses help us reduce myopia progression in U.S. kids. So we're trying to still find that sweet spot for the best atropine concentration, but we also want to look at glasses that are special just for myopia. So looking forward to that.
So thank you, Dr. Weise, for sharing with us about the MTS1 results and then how this lays the groundwork really for MTS2, and look forward to later this year in 2024. And Dr. Pineles, something that we talk a lot about is how grit and resilience and having perseverance are really a needed skill set for all of us in all of life. But what do you think has been the most helpful when confronting the challenges in clinical research, particularly clinical pediatric eye research?
That's a great question. I think that there are two sort of areas that you can think about. One is as a clinical researcher in general, and two is as a leader of PEDIG. I think in terms of being a leader of PEDIG and a leader of a clinical trials network, one of the biggest issues that we have is getting consensus on decisions that we want to make about a specific trial. It's been really eye-opening to see how difficult it is when you have so many smart people with so many great ideas and ideas of how a study should be performed, that sometimes you can get sort of paralyzed and things don't move forward because everybody needs to get on the same page, and that's really been a challenge. So I think resilience and grit are really important in that area when you're trying to be a leader. You need to work with the people who are the stakeholders, and you have to never give up. It's really difficult after an hour or more when a conversation is just going in circles because of a lack of consensus. And so as a leader, it's important to sort of put your own opinion aside for a minute and hear all the other opinions and try to work with people to achieve some consensus, even if it's on a very small area of the protocol, for example, in the clinical research realm. If you can get people to agree on one small area, then at least the conversation's moving forward and it feels better for everyone. So I think for me, that's been the biggest area that I've had to have, grit or perseverance is shifting from being somebody who's part of the conversation and moving into the role of trying to make the conversation reach an endpoint. I think that's really important in all of life.
Mm-hmm. No, that's so valuable. Dr. Weise, a similar type of question I have as the co-chair also is, has there been something that has been helpful when confronting the challenges in pediatric eye research, in addition to doing clinical research during a COVID-19 pandemic?
I agree with everything Stacy said, and I think it really reflects how much work goes into designing a PEDIG study and how many levels of review it goes in. So if somebody who's reading a PEDIG outcome paper, it's going to have had the most, rigorous levels of review. So I think for me, in addition to grit and resilience, I think you need to be intrinsically motivated by helping kids. If you're in it for, money and power, then, PEDS is not the field for you. So one of my mentors, Wendy Marshall, used to say, you've got to go into PEDS. You love kids. You don't care about money and you're a little crazy. And so if you don't have that intrinsic motivation, you're not going to stay at 5 or 6 o'clock at night to get the pediatric research kit done, and you're not going to withstand, the level of review and the writing committees and things like that. So it's so fun to help a kid in clinic. That's what we all do it for. And then when you're on a faculty or you're a teacher in some way or you're doing externships, then that is awesome because that person's going to go on and do some more PED stuff. But when you're doing research, especially in pediatrics, it's just so fun. Not only are you helping that kid and you might be helping, a trainee who's watching you, but you're going to, report these results. And, they're going to be read, potentially all over the world. If you like helping children, if that's what your motivation is, then doing pediatric research is for you because it's exponential growth on how many kids you can help when you do pediatric research.
Thank you for sharing that with us. That's great in terms of what really would make someone click in terms of being a pediatric eye doctor, whether they're in optometry or in ophthalmology. And Dr. Weise, what would you say advice you would give to optometry students, residents, medical students, fellows, even attendings who want to get involved with PEDIG and pediatric eye clinical research?
Try it out. If you have a mentor near you, then talk to them. I know, we've had Ruth Manny, Wendy Marsh-Tootle, Sue Cotter, and then in the ophthalmology world, Aisha Erzurum and Kathy Lee, and Evelyn was one of the first PEDIG investigators as well, starting back in 1997. And so if you can bend the ear of anyone who's already doing it, I bet you're going to hear that, the enthusiasm in their voice. And then probably pursuing a pediatric residency or a residency, get some more academic teeth to your training. If you want to become a PEDIG investigator, you do have to have a pediatric residency if you want to start out as a full investigator after your residency. During your residency, you can be an associate investigator, which is awesome. It's a way to, sort of get your foot in the door at PEDIG and see if you like it. So those are two really important ways, to kind of get started. Students should look at residencies in pediatrics, whether it's hospital-based or school-based. We should be bending the ears of our mentors, but also just reading the literature. And if you get inspired or you go, wait a minute, I think I could have done that better, or I think I might have asked that question differently, or if you just have a really great general curiosity, then, keep, taking steps forward. I like to say, you got to help us pay it forward. We've been uplifted by a lot of amazing people who've gotten us to, help so many kids, and we need more people doing that. So keep reading and just take steps forward.
That's excellent advice, Dr. Weise. Thank you so much. Dr. Pineles, what does a typical day look like for a pediatric clinical researcher and an ophthalmologist who's focused on pediatric neuro-ophthalmology?
The thing I love most about having clinical research as part of my career is that every day is different. And I'm not seeing patients 24/7 or doing surgery 24/7. I'm really doing different things. So 2 days a week, I'm seeing patients like every other pediatric ophthalmologist and doing surgeries on a half day a week. So 2.5 days a week, I'm either in the clinic or doing surgery. And I love that. But I also love the fact that on the other 2.5 days a week, I'm doing other things that are different and stimulate me in a different intellectual way. So I spend Fridays, every Friday, we spend on PEDIG calls. Basically, for me, it's from 8 a.m. to about 3 p.m. I'm on Zoom. And we're talking about studies and we're talking about investigators and patients and new ideas and really monitoring all of what's going on in PEDIG. And so I love those days. But then I come on Monday and I see patients again, and I can enroll those patients in studies, and I just see them as pediatric neuro-ophthalmology patients. So it's really varied, and the days in between, I'm working on editing PEDIG papers and working on administrative roles that I have within my department and leadership roles at UCLA. So the best thing about academic medicine and academic pediatric ophthalmology, and even pediatric ophthalmology in private practice when you have a focus on research, is the ability to have sort of a menu of options for how you want to focus your time and your career. And that can change throughout life. You know, you may have more time, you may have small children. There may be other times when you have more time or less time, more interest in seeing patients and doing surgery versus less. And you can adjust that and turn up the dial on any of those areas as time goes on. So that's sort of what I would say about my week. It's not the same each day, but it's really nice and variable.
That's wonderful. Dr. Weise, even though there is no typical day, what would you say that you would tell our listeners to what a pediatric clinical researcher and an optometrist would have for a typical day throughout the week?
Yeah, I think very similar to Stacy. 50% of the time is in clinic, and then the other 50% of the time is doing research and other brain stimulation, kind of fun. And so, maybe what I'll add to her answer is that she's probably got some protected time in her day, as do I, for writing and, doing some papers and, thinking about new study designs. And for me, that's 10 p.m. to midnight or 3 a.m., depending, so anybody thinking about doing research should think about a time where they might be doing, some one-on-one introvert kind of stuff. So they can really, write some papers and get some of that, sort of didactic stuff out there. Fun part about being in PEDIG and then also in clinic actively is that you sort of see the circle of life where we have the studies and then, they really stem from this PEDIG mindset, we call it, where, your patient comes in and you wonder, what should I do? Well, that, that wondering, and that curiosity could turn into a study question. And then, that could turn into a PEDIG study visit. And then, once we do the study, then actually the PEDIG investigators get to see the answers before they're published in the journals. And so we get to kind of tweak our clinical practice, a lot of the times before it's even published. And so that circle of life where we get to come up with the ideas, be on the cutting edge of the new ideas is, makes my day-to-day really fun.
That's great. So it's been an absolute pleasure talking with both of you, Dr. Pineles and Dr. Weise, about the current and future clinical studies in PEDIG. And thank you so much for your leadership and everything that you both are doing to really push forward the advancement of children's eye disease and everything that you're doing to push us forward.
Thanks so much for having us.
Thank you.
Of course. And on behalf of Little Eyes, Big Topics of APOS podcast, thank you so much.